All righty. Let me take this opportunity once again to welcome all of you to the Jacob Sabi Global Institute for Leadership Studies. We are so excited, so happy, and so engaged at this point because our program for today, this will be our third global webinar to discuss the issues of COVID and how it has impacted our society. Today, we are going to look at the subject on social change. And I am also very happy to welcome all our panelists and every individual from around the world. Folks are still logging in and folks are joining. So this is the way this program is going to run. A selected few will be displayed to join the panel. I'm looking at about 20 who face will appear on the panel list, and the rest of them will be on the webinar, so they can hear you and they can ask their questions through text messages or on the chat group. But they will not physically appear. The reason is because we wanted to manage the size of the viewership, so by that way we'll be able to interact effectively and with no distractions on the side. So for those who live in the United States, I want to take this opportunity to welcome all of you and also to wish you a happy 4th. And I hope that we will enjoy the significance of the July 4th. So without wasting much time, and again, for the rest of you who are joining our webinar for the first time, I will be your host, and my name is Samuel Jacob Sabi. I hold a PhD in public health policy, and until recently, I was also chartered as a global peace builder, professional peace builder from the University of George Washington of Peace. And so I also serve as a consultant for the United Nations, as well as the World Health Organization on COVID-19 responses. So by default, I have the technical and the knowledge base strength to host this event. And so I'm so excited that I have this opportunity to be your host today. The objective, though, the aim is to provide a positive perspective on how COVID-19 has impacted our lives. You know, whether we like it or not, majority, if not all of us, by December 31st, 2019, have high hopes, high ambitions. We have a lot of plans, prepared for our future for the 2020. But little did we realize that 2020 was going to be one, if not one of the most challenging years most individuals have encountered, especially for those of us in this generation. Few individuals who, by special grace of God, are still alive. This probably will be the second pandemic they are facing. It happened in 1917's area. But whether we like it or not, we have been impacted. And if we have been impacted, it means that there is a real challenge, a real situation, a real trouble ahead of us. But like in every situation, once we are confronted with the challenge, there is also an opportunity to overturn the challenge into productivity. The other objective also is to help participants to develop knowledge, competence, and confidence for post-COVID. As you all may know, in the various countries or cities or states, you will realize that government has begun a reopening, and we have to adjust ourselves to the new normal, meaning that we still have to go back to work, we still have to get on with our daily lives. And so how do we live our lives in such a way that the pre-COVID will not impact our lives? And then the final objective for this webinar, what are the lessons learned? I mean, how has COVID changed your life? How has COVID impacted you as an individual? And so that will be the primary objective for this discussion. Again, the Jacobs Abbey Global Institute for Leadership Studies, we are very grateful that the George Washington University of Peace, USA, have also partnered with us to host these global webinars. And I want to take this opportunity to thank Professor Riaz, who is the president of the university, for his great love for the Jacobs Abbey Global Institute for Leadership Studies. And for that matter, after this event, the institution will issue the certificate of speakership to all our guests who spoke on this event. Without wasting much time, let's go straight into what I consider the social change impact, COVID impact on social change. Social change is a way human interactions and relationships transform cultural and social institutions over time. It is interesting for us to come to that understanding that change is difficult, and anyone who thinks that change is not difficult probably is living in the moon. We totally understand that change is difficult, but when we effect change, we are able to as well change our community, change perspectives. Back in the years, in the US, for instance, Blacks, for instance, have no rights to even vote, let alone women. But through social change movements, this was changed. Now, it got to a point in the life of humanity that people with disability they are not even factored, and we are still having such challenges around the world, that they are not even factored in the governmental infrastructural processes. And so in some countries, you see buildings, high-rise buildings with no elevators, and no platform is made for people with physically challenged. But as the world progresses, as individuals like us begin to speak out, we've been able to make a lot of significant changes from around the world. We still have a lot ahead of us, especially in developing countries, to use social change to effect a process. But again, we believe that in order for us to push the agenda, we must keep talking. We must impact our society. We must use our knowledge base to change perspective of how society have accepted norms which are not right. And so the purpose of social change is always significant. And the impact of social change, for me, I strongly think that society has moved, from an emphasis of social support to one of individual responsibilities. We have come to a place where now people have to fend for themselves. People don't really care. It used to be social security system, Medicaid system. It used to be strong social networks to support communities. But we are living in a world now where, individuals have to fend for themselves, and nobody seems to pay attention. Even if government pays attention, they do that with a pinch of salt. And so it is of these challenges and factors that the subject on social change impact became relevant for our discussion today. And so folks from around the world and all those listening to us both on Facebook, YouTube, Be Inspired Radio, as well as on Zoom, both in the webinar and also on the phones, I want to take this opportunity to begin our series of today. I am so grateful and so happy that today our first speaker, and before I introduce our first speaker, I also want to suggest that in case you are not speaking, you can put yourself in mute. I can do that from here as well. I can help mute everyone, but it will be much easier from your end if you do so. I'm not only talking to the panelists, but I'm talking to all these individuals listening from around the world. So today our first speaker, her name is Mayowa Jolayemi, and of course her name tells you she's a Nigerian. And there's a story, you know, and I keep telling her that, look, your name is more of a Yoruba name, and I am a Gan from Accra, and history have it that we migrated from the Yoruba land, and so our names, our language all seem in peril. So sometimes you may speak something in Yoruba and it is the same as in the Gan language, and so but we'll come to that later on. She's the head. So let me go ahead and introduce her. So she is an enthusiastic social impact evangelist and programs manager at Center for Economic and Leadership Development, an organization in social consultative status with the United Nations Economic and Social Council, ECOSOC. She is fervid about girl-child education with special interest in STEM education, equity for women in the workplace, and youth empowerment. Mayowa has successfully coordinated other advocacy outreaches and intervention projects, which has supported over 1,000 school-age children, granting access, quality education, and empowering women to become leaders in their pursuit. Mayowa has worked extensively with private organizations as well as the government of the Federal Republic of Nigeria, overseeing the execution of both private and national geotechnical and geological projects. She has been abundantly commended for her excellent work delivery at all levels. Mayowa is also a teacher who previously taught at the Norwegian International School, Port Harcourt, where she was appointed into the school's senior leadership team. She has been greatly commended for her exceptional professional and leadership skills. Mayowa heads the external relationship unit at the African Leadership UK Limited, where she has been privileged to write articles which have continued to attract very high-profile mentions and interest in the prestigious African Leadership magazine. Folks from around the world, I am very excited to introduce my very good friend, Mayowa Jolayemi. Please, over to you.
Good morning, everyone.
Hi, good morning.
From everywhere you're watching from, thank you for joining us. I'm sure you can hear me clearly, right?
Yes, we can.
Oh, that's fine. Thank you, Dr. Sam, for that beautiful introduction. Thank you so much. And for everyone joining us here, thank you for coming. Dr. Sam, I want to commend you and your team for this beautiful work that you are doing, that you have started since May, and where we have discussed so many pertinent issues as it regards COVID-19, and it has helped so many people. And I consider it a special privilege to be engaging with great minds this beautiful day as we discuss the impact of COVID-19 on our social lives. And my focus this morning will be on the impact of COVID-19 on our work, the workforce, and then we'll talk about how we can ensure that our business worth is not diminished and productivity is not compromised, which is a very important aspect of our social lives. Thank you. Can we please go to the next slide? Or the next one. This will be the agenda. Thank you. Okay, I'm sure everyone can see this slide. Think about it. The message in the middle, in the blue box, I received this message a couple of weeks ago while the pandemic was, let's say, at its peak. And when I read it, it says, if you do not come out of this quarantine with a new skill your side hustle started, or more knowledge gained, then you have never lacked time. You have lacked discipline. Truth be told, when I received this message, it really did not mean much to me, it did not resonate with me. But I thought about it. So many people would have received this same message, and some would have felt guilty just because probably they have been overwhelmed by the negative information around and could not put their minds together. And some may have been motivated to want to do more because during this time they have maximized it, and some may have felt accomplished. But for someone like me, it really did not mean much to me. But I gave it a second thought. The next slide, please. Then I reconstructed the message, and it read, come out of this quarantine with a new skill. Your side hustle started, or more knowledge gained. Now let me explain this to you. You see, the World Economic Forum said that before year 2019, just about 2.9% of the global workforce worked remotely. And now the United Nations Labour Organization, that's the International Labour Organization, ILO, says that the COVID-19 has affected about 2.7 million workers globally. That's more than 50% of global workers. Okay, so this is where I'm going. If before COVID-19, 2.9% of 3.3 billion people worked remotely, and now 2.7 billion people have been affected by COVID-19. And majority of these people affected have to now work from home. That's a new skill that you have accomplished. That's one new thing that you have learned. Some people have begun a side hustle at this time. Most people joined online business, Oriflame, Longreach, and all of those. That's a side hustle. It may not be big. And so many people have gained new knowledge, probably not in your field of academic study, but you have done something. Then I tell you, that's an accomplishment. That should motivate you to do more. That's productivity, because you have learned to manage remote work, which you were not taught. So you have not lost time, and you have not shown yourself as one who is indisciplined. Okay, thank you. Next slide, please. Now, going by the United Nations Conference on Trade and Development, it says that no aspect of our lives has been immune to this virus, meaning that every aspect of our lives, our work life, our relationships, everything has been affected. And ILO went further to say that no matter where in the world you are, in whatever sector, in the telecoms, in the luxury industry, whatever sector, this crisis is having a dramatic impact on the world's workforce. So we cannot shy away from having this discussion, this all-important discussion on the impact of COVID-19 on our social lives and on our work. And then how do we ensure that we maintain productivity? One, we have learned to work from home. It might not be perfect, but we are getting better at it. Now, on the impact of COVID-19, which has brought us to a new normal, we have seen that 10%, that's about 305 million full-time work hours has been lost as a result of COVID-19. And then, like I said earlier, 2.7 billion workers have lost, have been affected. And then a very touching one is about 20 million Americans who have had to file for unemployment claims as of June 2020. And then the innumerable number of people in developing nations, like in Africa, in some parts of Asia, where we don't really have data to know how much impact COVID-19 has had on the workers, both in the informal sector and the formal sector. The United Nations General Assembly and the Global Compact has now made it a very important part that we should have social dialogue like we are having right now on the impact of COVID-19 on our lives. Because as it is, there is no urgent plan by any government to mitigate the impact of COVID-19 on our work. Even as some nations begin to open up, we really don't know exactly how to manage this thing, because in so many workplaces, not everybody is resuming. Some workplaces are delaying to resume. Some people are continuing to work from home. So we need to learn how to manage all of this stress that COVID-19 has brought in our work. And why do we have to discuss this? The decline in work hour, like I have said, 10.5%, that's a lot. The rising unemployment in developing countries. In UK, it's about 46% of people who have filed for unemployment. And then for this discussion, I'll focus on how we manage remote work to ensure productivity at this time, and then how we cope with these challenging times. So, in coping with the challenging times, some people have had to battle with, next slide please. So many people have had to battle with negative emotions. Can we please go to the next slide? Thank you. And you see, at this time, some had fear of the unknown. So many people have had guilt. So many people have lost loved ones. Some had gone into anxiety, depression, all because of the impact of COVID-19 on the environment generally, and on the economy and on our work. And you see, sometimes you could feel all of these negative emotions in one breath, and I'll tag that confusion. If any comfort, we all need to understand that no one single person is in this alone. We are all in this together. So you see, in coping with these challenging times, first of all, understand that this is a global crisis. It is not your personal issue. It is not your personal problem. So first of all, breathe and relax and understand that all the disruptions that we are having now is a global crisis. It was not your problem. You did not cause this, so that you can focus on the work at hand. Now, when you are able to understand that COVID-19 is not your problem, and that COVID-19 was not caused by you and is not a problem on you alone, it is a global issue. Although we have different experiences based on our location, based on peculiarities of our lives, you need to free yourself from all of these negative emotions, all of these mental roadblocks, and then ensure that you do not pressure yourself into some frustrating expectations that could put so much pressure on you. But the first thing you should do then is to engage constructively with yourself. And how do you do this? Free your mind from all the fear, all the guilt, all the anxiety. Engage with yourself. Find that place in you where you find yourself in the best frame of mind. And then you see, when you are able to put yourself in the best frame of mind, this is your first step to being productive on your work. Because when you're loaded with all the negative emotions, it keeps distracting you from the focus. It keeps pulling you down. It keeps taking your attention. Now, when you're able to put yourself in the best Okay, can you hear me now?
Yes.
Okay, thank you. Now, that's on mental health care. The second one I'm going to speak on how to ensure that you can be productive in these times is to upskill. It's when I say upskill, it does not really mean that if you are an engineer, you should take up engineering courses. If you are a doctor, you should take up courses because currently you're not going to work or something. No. You can take up courses in liberal arts. I'll give an example. A few weeks ago, I registered for a critical thinking course from Imperial University. And I can tell you, I have been having a fantastic time with this course that I am taking. It's helping me to think critically, to understand how to bring things together, to solve problems. I'm learning so much from it. It really does not have any direct impact on my work, but I tell you, it is very significant because I know that it has really helped me even in preparing for this presentation. And it helped me to free myself. I was not under any pressure to meet any deadline, to submit assignments or any of those things. But I knew I was adding knowledge. It's helpful. So when you're able to upskill, you're able to register for trainings, for courses, it will help you open up your mind to be able to learn and also to be able to give yourself to the work at hand. Then the next one is on internal reflection. I'm going to use the example of diamond to explain internal reflection. You see, a diamond is regarded as a woman's best friend. That's because a diamond glitters. And the reason a diamond glitters is because when you see a well-cut diamond, then the light that comes into it, the incident ray, it reflects all of it back to your eyes. And you feel, oh, it has so many colors. Now, on internal reflection, when you are able to look within yourself, now when you have upskilled, you have added knowledge, that enlightenment, when you are able to bring in this light within yourself and you can think about who you are, really, not how your job describes you, but who you believe you are, what you stand for, what are your values, what are your principles, then you will be able to project the best of yourself to the world. That's because your mind is in its best state, in its best frame. So with internal reflection, you're able to put light into yourself, and then you're able to reflect the best of yourself. You think about who you want to be, what you want to do, and then you take strategic steps to design and develop yourself in this path that you want to be known as. An example, if you want to be someone who acts, you can read about it, and you are presently not in that field. Read about it, take courses, and then engage with people who do that. You will find yourself where you want to be. If in your company you want to be better, this is a time to take courses on how you will learn better on what you do. Then this is internal reflection. You will be able to bring out the best of yourself, just like a diamond. And then the last one other thing in coping with this time is that you should engage your hobbies and engage in sporting activities. You see, this time has enabled me like never before to put myself into some things I love doing. One of those is making pastries. This time, I think I have made all the types of pastries I had always wanted to make. And it's been fantastic. I'm enjoying it. My family is enjoying it. We're all doing well. And when I am done, I can go back to my work because something that I love doing, I have done it. That's my hobby. And then in sporting activity, I have not been going to the gym, but within my house, I have exercised my body. And we all know that exercise helps us to develop our body. It keeps your body in shape, and it also keeps your mind free and focused. So you see, in coping with these challenging times, when we are able to apply this 4 aspects, it's going to really help us to be productive on our work in a time like this. Now, as I conclude, next slide, please. Thank you. You see, the growing need, like I said, I will be discussing coping with this time, which I have done, and then how to manage remote work at this time. The growing need for remote work, and now that countries are opening up and the lockdown is being eased in many places, we have to work in the office, but with minimal contact. We need to have conversations like we are having now so that we can ensure individuals who drive the success in the organization continue to thrive and that productivity is not compromised. And how do we do this? According to a Deloitte 2019 publication on the future of work, it described work in 3 dimensions. It says work has 3 dimensions. The first dimension is the enterprise, which is the work we do. If you are a publisher, the magazine you produce, you publish, that's the first one, the work you do. The second one is the workplace, your office, the location of your work. And if you are an informal worker, probably you sell, wherever it is you sell. That's part of your work also. And then the third one is the workforce. That's the people who do the work. Now, according to Deloitte, these 3 aspects, these 3 dimensions of work are very significant. They all play significant roles in ensuring that the organization grows and the organization is productive. But you see, according to that report also, it says that the worker, the workforce, in particular people who work, now it did not bring them together. It says an adaptable organization has resilient individuals, resilient persons who create more value at the heart of the business. So it means individuals are the ones who drive productivity. You and I are the ones who drive productivity in our workplace. Now that the United Nations Conference says that all aspects of our lives have been affected, it means that the workforce, and the workplace have been affected by COVID-19. But the worker who drives the productivity, how do you ensure that work continues? Productivity is not compromised. I have designed this measure, which I call the personal accountability measures. You see, this personal accountability measure aligns with the wise saying for productivity. And it says that success is in your hands. So I like to call it PALM. I understand the PALM is called PALM with an L, but this is a PALM, so you can remember. Personal accountability measure. And it establishes that you cannot, another wise saying says that you cannot climb the ladder of success with your hands in your pocket. That shows that if you, as a resilient worker, must be productive, must drive productivity in your organization, you cannot sit down and expect productivity to produce itself. It has to be produced by that resilient worker. So what are the things that you must do? I say it behoves on you as an individual to set realistic, job-specific, and environment-controlled goals to help you deliver on expectations. And you see these goals, these expectations, this realistic plans, these measures I have listed here. Number 1, you have to limit distractions. What are the things that distract you? Probably the news, the information on social media, the people in your environment. You limit that so that you can be productive. And like I said, it is peculiar to you. That's why it is a personal accountability measure. No other person can help you. They can help you keep your plans, your promise, but they cannot do this for you. To be that resilient worker that the organization needs to be productive. Then the second is to understand your values. What are your own values? If you are that person whose work prior to now has been sloppy, you want to be that person who is reliable, then you have to decide. How do you do that? The next time you are given an assignment, make sure you submit it at the right time. You only can put this on yourself to ensure you are able to do this. These are values. How do you want to be perceived? What do you want people to say about you? And then you should, if you are to work from home, you should have a designated workplace and then have defined goals. This week, today is Friday. Let's say next week, what are the things I plan to achieve? I plan them out this week, this weekend, and I ensure that these goals are fulfilled. These are not what my bosses or my superiors or anybody will pursue me to do. These are decisions I have personally taken. And these are things we should do. If you want to be that person who drives the success, the value of your business, of your company's business, probably you are the business owner or you work for someone, you need to become a resilient worker. Then the next one in your personal accountability measure is that you should not procrastinate. Whatever you need to do now, you do it now. In times of crisis, it is very easy to procrastinate because things will always want you to delay the important things. You should ensure that you don't allow that. And then in developing nations where we have the data that internet connectivity is not so good, ensure you have efficient network subscription so that you don't always give excuses for not turning in work at the right time. And then you see the next two, which is focus on priorities. It will really help everyone who desires to be that resilient, that trustworthy worker to deliver productively in his or her workplace. Focus on what is priority. What does the organization want? What is the organization aiming at? Help the organization achieve the goals. You will definitely bring out productivity in that. And then the last one, which I like most, is plan to exceed your KPIs. When you plan to exceed your KPIs, not only are you doing yourself some good because you will be rewarded, you will be applauded for that, you are also building a culture in the organization where everyone will aim to outdo themselves. And when there is this healthy competition, you will see that the organization produces at, maybe not at peak at times like this, but the organization will not be at loss at times like this. So like I have said, the personal accountability measure is a personal decision that every resilient worker has to take to ensure productivity in the organization is not compromised at this times. With this, I have come to the end of my presentation, and I hope you have gotten some good points to help drive productivity at this times. Thank you very much. Thank you so much, Dr. Sam.
Thank you so much. Thank you so much, Mayowa. It's a very, very powerful presentation. Folks on both Facebook and also a lot of questions have come in for you, and I thought you touched on a very important segment and different factors that everyday individual needs it, especially when people are confronted and have problems with how do you call it, with job, and lots of people have lost their job. A lot of people are living on unemployment compensations. So you hit the nail right on the head. Thank you so much. So we go to our next speaker for today, and she's going to speak on the topic, empowering local communities to develop innovative solutions for developmental challenges in the era of COVID-19. Lydia Abena Nyarko, a Ghanaian-born New York resident, is a director of AbibiNsorma Foundation and a research officer of AbibiNsorma Foundation, a Ghanaian-based civil society organization. Lydia also serves as operation manager at JOPAP Resource Ghana. Lydia has been a champion of human rights, girls and human rights. She holds a Bachelor of Business Administration degree with a special concentration in human resource management. Through her work with the AbibiNsorma Foundation and the AbibiNsorma Foundation, she has impacted many lives and make the subject of human rights, climate change, and social justice a priority. Folks, please help me welcome Lydia, who I've known for a very, very, very long time. Very, very, very long time. Lydia, over to you, and welcome to Jacobs Abbey Global Institute Global Webinar. Over to you.
Thank you, Jacob. I'm really glad to hear from you once again. I'm really privileged to have the opportunity to speak on this platform. You said it all. I want to, first of all, congratulate the first speaker. She gave a good speech, and I also stole some of the things that she said, which I am really impressed. Doctor, thank you. And to all the panelists, we are all welcome. Viewers across the world, we thank you for joining us. Today on an interesting, on a very blessed day, is a Republic Day for America, and we are all privileged to be part of it, because many are those who are not with us now due to COVID-19, but we are still strong in fighting this COVID-19. I want to talk on the topic, empowering local communities to develop innovative solutions for development challenges in the era of COVID-19. It's been over 3 months now since the whole world fight to defeat the coronavirus. We all agree that the person of disease has tracked the world into the uncalled new normal. So we are actually living in the new normal. And again, we have been able to attain the institutional voids that the virus has revealed. I know there are many places that we can talk about, but I just chose just a few to talk about it. I want to start by defining what empowering is. To empower somebody means you are giving somebody the power to do something. Just simply put it, you are giving power to the powerless. You can empower somebody through training, education, awareness, sensitization, etc. I want to start with the next slide, please. I want to start with the health sector. As I said, if you look on the slide, I just indicated the topic I'm going to talk on as a head. So the first one I want to talk about is health. The health system has been hit in this pandemic. Much attention has not been put to non-communicable disease, but this COVID-19 has brought a lot of health problems that we have seen and witnessed all over the news. We have seen that in our communities, we lack infrastructure. If there's an overflow of such, our hospitals don't have the capacity to accommodate all these people. When you go to the hospital and you have COVID-19 and you are not showing any symptoms, believe me, you will be asked to come home. Other related diseases, diabetes, the cancer, and all of that has been put on hold because even with the people who have been affected, they are not even getting accommodation, how much more the rest? So what happens to them? Before COVID-19 came, there were diseases already or illnesses that the hospitals were dealing with already. But now, all attention, majority has been drawn to COVID-19 patients. So now, even if you cough, everybody looks at you in a way. If you sneeze, instead of they saying, God bless you, everybody's going away. So yes, this is the new normal. We realize that our local communities, our hospitals lack PPEs, not about ventilators and items that they will use even in taking care of the patients who have been affected. Then you realize that we have problem with testing kits. You have to go join long queues, or better still, there's no testing kits. If we go to Africa and some of the other countries, we realize that some even have problems even with the test kits. So some of the challenges that the COVID has brought about is that there's less testing kits for other people to get tested with. Also, when you go to other deprived communities, you realize that health insurance, they don't have health insurance coverages for the majority of the people. So in the health, how will they even assess the health facility if they don't have the health insurance? Are they going to do, what's the name of, when you pay and you get a service, how many people can even afford the services they are rendering at the hospital with that charge? So these are some of the challenges that COVID-19 has brought. I know there are millions of challenges that are going on in the health sector, but I have given out a few. I also thought of certain solutions in this era. What are new ideas that would stand out? As our first speaker said, there are lots of things that we can do to keep the bottom. We have other skills that even for us we don't know. How can we also find that out? So in the solution for the health problem, I suggested that the government should come up with a comprehensive and robust insurance policy available to everyone, those the rich, the poor, the low income, everybody, so that everybody in our community can have access to the hospital, can go to the hospital and get treated for whatever without not having to pay so much a fee. The second is that I know that all the scientists all over the world are on it to come up with a vaccine to help stop this COVID so that people will come out to live their normal lives. So all the scientists, we are also charging them again to fast forward the pace to coming out with a vaccine that will help stop this COVID-19. Also for manufacturers, we're also asking them to come out with PPEs cheaper for everybody. It will be advantage points for everybody to access PPEs without even spending nothing on it, because according to WHO, it's contagious. So we want them to come up with something that maybe there'll be an innovation, that there'll be like a stand or a kiosk. So if you are even in public, you don't have a PPE, it's all set. You can just go and just pick it up. Also, now we can also develop an app that even when you're in a crowded place, it will even indicate that you are supposed to start social distancing in the midst of the crowd, so that you know your limits when you are in public. Now we're in the technological era, and so all these things come to play. Also, I know we've started with this whole virtual calling with our doctors, booking appointment, talking to them through virtual call. They're giving us treatment. So we can also inculcate that in the system so that everybody can access a health sector at ease without not going to join long queues, without not going to go through any hassle. So these are some of my solutions that I've brought concerning the health sector. Please, the next slide. high illiteracy rate is killing majority of our people. Globally, about 775 million people are illiterate. And literacy also affects every area of our life, every aspect. Because if you're illiterate, it means you can read, you can understand. So if there's something going on, and in the local communities, we're supposed to come down to the people to understand. This is what is happening. This is a new pandemic. This is what you're supposed to do. We are not getting the people to understand exactly what we mean when we tell them A, B, C, D, because of one word. What brought about the illiteracy? Poverty. Poverty. Our systems are such that even if you don't have money, you can access education, proper education. People tend not to go to school because they can't afford it. And it's as a result of poverty, lack of funds. People don't have the resources to champion their children or themselves, even bettering their lives through education. And illiteracy is you being able to read and write and understand what somebody is saying in a particular language. There's inadequate infrastructure for education to carry on. And also in the era of COVID-19 that everybody is even inside, there's nobody going out even to, learn, because they don't understand ABCD to even go to the computer and say, I'm going to learn through Google, I'm going to learn through the internet. So these are some of the challenges that illiteracy has brought. And this all of it, there are lots of rules we are supposed to abide by. But believe me, they don't understand it. I watch videos of other countries, and you realize that it is so sad that they don't understand the gravity of the disease, and they're just making a whole joke or fussy about it. Oh, it's not real, it's just this, it's that. But you and I and many who are in developed countries knows that it is real, and it's taking a lot of precious life. Our friends, our parents, our loved ones are being taken away by COVID-19. Next slide, please. Some of the innovative solutions that I brought was in the community was, we have a lot of NGOs, a lot of pressure groups. We're supposed to volunteer in our communities to help champion this cause to dialoguing in our local dialects. When you speak somebody's language, the person sees you as one of theirs. They understand it deeper than always speaking a language like English that they don't understand. They open the television, they don't understand what is happening. So we have to champion our cause through communication in our local dialects, that people will understand exactly the extent of this disease and prevent themselves. Also, we do that through donations of books. We can donate books, we can donate educational materials, we can donate a whole lot of things, learning aid materials, to help these people in our local communities understand the gravity of what is at stake and do their best to stay safe. We also will have to champion the NGOs to come out with a comprehensive government policy that everybody in the community will have free education, not just free and quality education, build infrastructure to allow the members of the community educate themselves in their own small way. They should be able to understand when there are certain things written, they'll be able to understand what is actually at stake and what is going on. Please, the next slide. Unemployment is the third one that I raised. My first speaker said a lot about unemployment. A lot of people are now working from home. Every home, you get people working from home. And it has become a new normal. How many people appreciate working from home? In the home, our systems are such that when we get home, we go with our families. Our dining tables, bedrooms, have now been turned to working zones. Even some even don't get up at all to do. Majority are home, millions are home without employment because of COVID-19. Even for essential workers, even to some extent, majority are home because they have been affected by the virus. People are finding difficulties even getting a job. People are not even graduating because they can't go to graduations because of the COVID-19. So let alone finding new jobs whilst other people are getting unemployed. This COVID-19 has become a big challenge, and unemployment, like health, is also hit severely by it. Next slide, please. So what are some of the solutions that we can come up with in our community? In our community, the people we look at every day, we have to empower the youth in the community into learning informal skills. Yes, you went to the university, you have a degree, there is no job. What next? What can I do different? What skill sets do I have also embedded in me that I can do? Is it bead making? Is it hairdressing? Am I good at talking to people? Am I good at even teaching people how to exercise? What that thing that I can do in this lockdown, that at the end of the day, I can get a new skill for myself. I'll be helping somebody and I'll be helping myself. Our youth in our communities should be empowered with skills like that, other skill sets, agriculture, a lot. Those who are also good online can also go online. They can do research, they can do online marketing, buying and selling, business goes on. We should not just get focused like we go to the office and just working. We can also work from home by going online, doing our own shopping, our business day-to-day business activities online. The youth should also be encouraged to go into sectors like agriculture, other things that in quotes our parents will not want us to do. They all want us to be doctors, the lawyers, the bankers. No, other things, artists, artisans, carving, all that. All these things make a beautiful world. So we can also learn a new skill set through this COVID-19, as our first speaker did mention. Also, we have to, in our educational system, we have to teach students how to be entrepreneurs, not always waiting for the government to come out with jobs for them to do. They have to teach how to be entrepreneurs, more than managing or more than just going to school. They have to be taught how to be entrepreneurs, how to be creative on their own, come up with jobs for their own selves that they keep on. And also, we have to involve the government to bring a lot of policies that would combat this whole employment thing. Because come up with economic reforms that the unemployed youth can also access a job somewhere or do a job somewhere in his or local communities. Next slide. Dealing with these challenges identified in the local communities require the active involvement of all the major stakeholders. You, me, the government, our parents, the youth, NGOs, religious body, everybody should come on board so that we can fight the COVID-19. So that in the years to come, we might say, yes, we championed something and we're able to conquer it. It is easy and it is possible together. Thank you. Thank you very much.
Thank you very much. Thank you very much, Abena, for a very powerful presentation. I like the perspective at which you looked at the subject matter, because I mean you were once living in the Epic Center in New York with all this Corona. So your storyline, I mean, tells a perspective because you saw it all. Thank you so much for your detailed presentation. Next one, it's my very good friend. It's one of the few doctors that I admire and appreciate very well. And Dr. Adoo knows that I don't hide how much I appreciate his work and how much I appreciate him in person. You know, I've had a lot of professor friends, but it's one person who is very thorough, very analytical. Even if it is one line, you want to make sure it is of the best of quality. And it's one thing that I admire about him so much. So Dr. Yaw Adoo is an international education and organizational management consultant, a faculty at University of Virgin Islands, and a social commentator. His research interests focus on employee work motivation and well-being, organizational change, and uncertain employment relations. He's a member of the editorial board of the Journal of the Georgia Public Health Association and founder of Education and Management Consulting, LLC, a consulting company providing services to businesses and governments. Folks, I must also mention, if I don't say this, it will be a big error, that Professor Adoo and I went to Adisada College, the best school in the world anyway. For that reason, Bucky is laughing. For that reason, please let's welcome Professor Dr. Nana Yaw Adoo. Please, over to you.
Well, thank you very much, Dr. Jacobs. I am quite honored, just like the rest of the panelists here, to contribute to the conversation about finding creative ways to manage the new world order that we find ourselves in. We are in unprecedented times. I believe the last time we faced something just as big, at least in North America, is when 9/11 struck, where people had a different mindset about how to live, how to cope with different challenges that come our way. So I guess at the end of the day, this conversation that we're having is intended to make us reflect on who we are as a people and our functions within the community that we live in, so that we find new ways to manage all the challenges and opportunities that arise as a result of it. So what I will be sharing will be on the deliverables of capacity building, as well as leadership and the pandemic COVID-19. I also am coming in with experience as a public health educator and as as a consultant working with small and medium-sized companies, as well as a couple of governments around the world. So my assessment is based on quality peer information that you would have to add to what you have to make informed decisions. So if you can go to the next slide, I will appreciate it. So the way I am looking at, when you presented to me to be part of this awesome conversation, is to look at the issue of capacity building. A lot has happened with that space. When you're talking about capacity building, in many academic, I would say, education fields, it's not well, I would say, embraced, particularly in these new times, right? So, and I'm saying this because we have new challenges amongst a lot of different people, at least in North America, how to relate with different types of people based on their gender and the color of their skin. So capacity building has had a new way of approach. I'll be looking at, let me define that first. Capacity building is a process of developing and strengthening. Develop and to strengthen, things like skills, abilities, instincts, processes, and resources, right? You want to develop and you want to strengthen. There's a reason why you want to develop in the first place, and to strengthen with the hope that it transcends to survival, so you can survive as well as to adapt and to thrive. Survive, adapt, and thrive. Now, this pandemic, this is not actually the first time we've had a COVID type of a virus. This particular unique COVID virus it has a different strain, right? So the DNA of it has a different way of manipulating in humans. So I'm not going to go deep into that. But what I want to overemphasize is how to look into developing and strengthening whilst we are in the space of COVID, to develop and to strengthen. So we can start by looking at some of the, I would say, highlights of the pandemic. And I think Lydia and Abena, Lydia, and Mayowa mentioned some of these, but I want to mention the highlights that I would say can also add to the conversation. One of it is flattening the curve, right? So a lot of different entities, governments, local entities are looking at stopping the incidents, the morbidity and mortality rates, to keeping it at a particular flat level so that we can be able to become, better people whilst we are looking for a vaccine to deal with it. So flattening the curve is one of the highlights of COVID. Recovery and reopening challenges. Some entities are looking at when do we start, when are people supposed to come out and work and enjoy the communities they live in spite of the virus. There is a conundrum on that issue. There's also the highlight of supporting healthcare and justice systems. I think Lydia mentioned this extensively. How do we go about supporting hospitals, people, looking at some preventive measures, like, as easy as wearing masks, all the conversations that go around it. These are some of the highlights. And we also have the highlight of protecting the most vulnerable amongst us. There are so many people, including people with disabilities, people without jobs, people without, there's so many ways you can look at how people define vulnerability. Empowering the informal economy. Now, this is huge in Africa particularly, and maybe in Asia as well. Many people have to come out and sell on the streets to make money and, to sustain their families. They just have to. They can't stay at home and work from a computer to make money for their families. They have to, peddle their wares and stuff. So governments in these areas are looking at, how do we make sure they come out and be able to, engage in some level of employment activity. And then one which is also very tricky is preventing misinformation. Now, misinformation is a big one in North America. You have some folks who believe that COVID is a hoax, and it has the theory comes from party lines and things like that. Some believe there are cure for it already, and all the noise that surrounds it. So these are some of the challenges respect to highlights that I will be looking at how capacity building can connect, so we can have continuous conversation to see what best fits which region. Now, with this as a backdrop, you have on your screen here 3 very unique, I would say, paradigms by which you can look at it. So who, with the information that we've heard already, who is going to be involved, right? Who is qualified to be engaged in that situation? We have individuals, governments, groups, and ecosystems, right? So all of these entities are supposed to be part of the conversation in driving capacity building. Who, what, right? So there's also the challenge of what, what is being discussed here, right? What is being built here? Why do we have what has to go into place to make sure that capacity building in terms of strengthening the assets that we have to make sure that we get to sustain ourselves with this pandemic. And you have to look at knowledge of people, the quality of education of the people who are supposed to be in the conversation, the skills, operational systems in place, how to support governments or how governments can support its people and delegate some of its responsibilities to people, empowering people. We heard Abena mention a lot about empowerment. And at the end of the day, how effective are all of these things, right? The knowledge, the skills, the instincts, the abilities, how effective are they per the region that you are in? And then how are you going to do this? How is capacity to be accomplished? At the end of the day, the people, the individuals, the organizations, the ecosystems have to know that, yes, we did a good job or we have room for improvement. How do we assess that? Training, different types of training can be considered, different types of technical assistance. It could be not-for-profit organizations, involvement. It could be expatriates involvement. Of course, taking the necessary precautions associated with COVID, right? Experiential training, experiential learning. Experiential means you have experience and you're using your experience to help guide to find a solution, right? And then peer learning from each other. These are, so who, what, and how are very necessary initially to be tackling issues for capacity building. Now, next slide, please. So, when we started, I think I heard Dr. Jacobs-Abi talk about social change, right? That social change is difficult. I have a unique take on that. I think that change is an experience, right? Change is more like an experience. So in other words, the way we see things, we have to find a way to define it by not going negative in default. So one of the ways by which social change is an experience, one of the ways is the difficulty associated with learning something new, right? The difficulty associated. Now, that difficulty is not everything. Change is really actionable. So the way you see something new, you have to be able to decide, how am I going, do I want it in the first place? And if you say no, you have to be ready for the responsibilities associated with the decision you make, right? So if you say no, what you have been doing for a long time, is it working for you? Is it working for the government? Is it working for your community? Is it working for you, in dealing with the new way of living in a pandemic setting, right? So if it is not working for you, then the question becomes, what are some of the strategies that I can look into to become a better version of the situation, right? And then if you decide on a strategy, is this a strategy that requires some level of risk? And is it the type of risk that you have equipped to manage? Results focus is just as important, and agility, how you can move and swivel or pivot, is another. So what I have really tried to, the picture I'm trying to paint here is, in as much as we are building capacity, developing different new ideas and strengthening those ideas, right? That's capacity building right there. Now, how does it translate into leadership? Now, what you see on the screen, strategy, action, and results, are what basic leadership is, right? People who lead are people who take action or who decide, who make a call. And the call they make, they have a unique ability to motivate other people to buy into that call. It could be negative or it could be positive, but either way, people who lead are those who say to themselves, I am going to take the bull by the horn. I'm going to address an issue, in these new times that has never been done before, and be able to convince somebody else to totally understand what I'm trying to do, right? And you do it through an action, right? So that's what core leadership is. I am proposing something different. I read a lot about this, and what I find to be one of the new ways of looking at living in today's COVID times is adaptive leadership, right? So adaptive leadership adds the core leadership with 4 new paradigms, right? We have emotional intelligence, organizational justice, character, and development. It doesn't have to be in that order, but I am proposing that when we decide to be people to lead our communities, or when we decide to look into trying to change our current situation to be able to live in these new times, because a lot has changed, right? Then we have to ask ourselves, am I ready? You know, do I have the skills? Do I have the equipment? Do I have equipment to be able to, live and live comfortably to a degree, or to be able to make an impact, right, despite your current situation? So emotional intelligence is one of those things you have to look into through adaptive leadership. And that is where you manage your, you are aware of your surroundings. You are aware of where you are. If you are unemployed, you have to buy and understand that, okay, I don't have a job. I need a job, right? So believing in that means you are now prepared to look into ways by which you can find the job that you desire. You have to self-manage, right? So if you have whatever amount of resources you have to say to yourself that you want to stretch it over a period of time for yourself and your family, for example. You have to be socially aware of what's going on. That means when you are watching television, the information that you are getting from television, for example, you have to decide the information coming, I'm not going to embrace the negative side, and I'm going to embrace just the positive side. Now, this is a very, very difficult part because some folks tune out, right? The decision to tune out may not be acceptable to a degree. You have to say to yourself, now, you're in charge of your body, and you are not going to be looking at the negative, but you are looking at the positive. Or you can choose to look at the positive as an opportunity, right? So, and then relationship building and relationship management is just as good. For a lot of people in communities with families, you'd have to know that, especially when you lose your job, right? And you have a family to feed. Sometimes the stress that is associated with that situation can, unfortunately, some people, it can lead to divorce, death, even getting, COVID itself, and then, all the other challenges that may come with it. So emotional intelligence or emotional quotient is key here when you want to look at adaptive leadership. The next is organizational justice. With the institutions within your community that is already set, right? You have to see whether the institutions are fair. Now, some people believe in equality. Some people believe in fairness. I lean more towards fairness. And this is why. When fairness, my explanation will be you prepare yourself to be in a position to get what you want, right? Equality, sometimes you don't prepare yourself, but you believe that you're entitled to it. There's no such thing as entitlement in these new times. You have to go get it if you want it. Now, if you decide to want to go get it, whatever that you're looking for, you have to look at, am I ready? Do I have the tools to be able to allow you to get what you want? So, if you want a job, understand that there are other people who want the same job. So how you are not entitled to the job, but you have to prepare yourself. That means you have to get some education. You have to get good quality mentors around you. You have to be knowledgeable about the disease of COVID and how it can affect you. You have to really prepare to make decisions along these spectrum. When you have the information, it is your duty to share the information. Why? Well, because if you don't share, it becomes obsolete over time. So someone else has the information, and they'll be able to share with others, and then they get to the next level. If you keep any information to yourself in today's times, you may be the only one left behind. There's a reason why, for example, especially those of you who listen on Facebook. Facebook has been created for free, right? And a lot of very smart people decided on that particular platform. Now, can you imagine if you had to pay to experience this? You know, when you share, you build better, right? Outcome concern, whatever decision you make, there may be some of the decisions that you make that may affect your personal views, your personal values. So the challenge between what you truly believe in and what is really in front of you can be very, very tricky. So what that can do is, because you're working in different settings and working with different types of people, you can decide to look into, okay, you know, how do I address any concerns I have given the rules, the laws that is being set up, you know, in front of us. For example, I think in Ghana, Accra particularly, you have situations where some people are pulled out of vehicles because they are not wearing masks, right? You know, they have the masks, but they may not be wearing the way some folks may perceive it to be. So that concern drives public outcry and things along those lines. So when you are looking at adaptive leadership, you have to be a little bit more sophisticated in your thought and your thinking, in your reasoning. You know, it doesn't take you know, just one time to do it, but it's something that you have to consider. Then your character. You have to have values that you treasure and be able to activate those values. You have to be a person of integrity if you want to lead through adaptive leadership. Now, integrity is a very, very expensive character to have. You know, it's built over time, it's built with trust. So, you know, and, you know, some folks will say that, you know, nobody is perfect, but nobody's looking for perfection. It's just that when you, how do you bounce back when you make a decision that is not favorable over time, right? So credibility is also important, and values differences, how to embrace other people's values. You have to have the skill to be able to know that if you want to live in these post-COVID times. Then the last component of adaptive leadership is development. You know, in order to do that, I think Abena mentioned this as well, in terms of getting some education. And I also think Mayowa mentioned about she's trying new things with a new certification, things like that. So lifelong learning is important if you want to be an effective adaptive leader, because adapting means you are pivoting. You are trying to live the best way possible with the tools you have in these critical times, right? And of course, when you're developing, it's best to develop with others. Next slide, please. Now, what you see on the slide here puts it all together, right? To become an adaptive leader. Again, the title is Building Capacity for Quality Leadership. You know, I'm overemphasizing the leadership to be adaptive leadership. So you have to be able to adapt in these new times. Now, what you also see is some of the things that you can, that provides examples of how to become an adaptive leader. You have to get off the dance floor, meaning you have to, you know, understand that you're in a new space now. If you are unemployed, you have to find a way to get jobs, right? If you don't know how, there's help out there. You know, you just have to ask. You know, you can go on Facebook, for example, and, you know, or, you know, some folks have very innovative ways of actually doing this. They can, you know, look professional and be on the streets with the placard that says, I need jobs, you know, I'll get a job. If you can hire me, then you give me money for alms, things like that. So, you know, you have to be very adaptive to be able to live in these challenging times. You have to know how to embrace failure. You have to know how leadership and authority, the differences between either, you know. You have to have empathy and sympathy skill sets. You have to know how to build mutual trust. You have to know how to formulate constructive conflicts, you know, without cursing or without yelling or without, especially when you find yourself to be unemployed, you know, because again, when you are really unemployed, for example, you think very differently, you know, you do. I've been there before a long time ago, and, you know, your mind plays tricks on you sometimes. So, but even in spite of the challenging times you may find yourself, it is expedient, it is important that you look at how do I really live in spite of the challenges. You know, you have to know how to expect plans to change, and plans can change over time. Today, you will hear that some communities are, you know, the COVID incidence rates has gone up, which has forced, you know, the government to ban this or ban that. You know, the next time you see that, it's not, right? So things really flip over time. You have to be able to understand the change and have the tools to be able to deal with it. Next slide, please. All right, so these are some of the responsibilities. I think I have mentioned this earlier, but it has to be considered when you want to associate capacity building. You have to know that patience is currency. You have to be patient. Now, this is very important. You have to know what patience is. Now, you have to define patience, right? So you have to decide within a month, for example, with all things happening, you have to make some decisions how you can live, how you can respond to different things, you know, that come around you. If you have a family member who has COVID, for example, you have to know all that there is, that, you know, to be safe for yourself. You have to believe that with time, your family member can be safe, right? Because patience may also come with the lack of the medication, or I would say that hasn't been developed yet, right? Or the medicine that actually has to deal with COVID yet. So, you know, patience is the virtue that you have to look into. You have to use reliable data and information to be able to lead. Now, reliable data is key, right? So you can find it from government sources, you can find it from quality publication materials. You know, you may not find it from Facebook, but you make it a point to look at where information that you have can inform your decision. You have to understand what creativity is. It is important that you try new things. Failure, there's no such thing, right? So for me personally, there's no such thing as failure. And what I mean is, when you try something and you don't get to where you need to be, it gives you experience. It doesn't mean that you have failed. It means that you have experience to know that if you try again, you can go about it differently, you know. So don't worry about failure. And I know it's easier said than done, but at least find a way to understand that trying new things is important, right? Demand effective feedback. So whatever that you do, make sure that the feedback you get is effective. Effective means, is it practical? Is this something that I can afford? Is this something that will make sense to you? Is this something that, you know, can allow you to make a decision even in these times, right? Some folks are working remotely and on, you know, using virtual means. Sometimes it may not be effective, you know, but that means you have to know how to find the next best thing, right? You have to teach and mentor in team capacity. Mentorship is important at all levels. There's no such thing as knowledge is in one person's head, right? So you can tap into other people that you can trust, you know, and be able to maneuver about living in these difficult times. And again, number 13 talks about managing the risks on the next slide. Now, the next slide has about 10 types of risks that, you know, you have to be on the lookout for in dealing with leading your team or leading your organization, or trying to be in an organization which is COVID sensitive. You know, competitive risk, economic risk, operational risk. Now, these risks are associated, there are several others, but I needed to make sure that you know that when you talk about risk, you're not just throwing that word out, right? There are so many different things that you have to look into that can help you make a decision accordingly. If you live in the United States, credit risk is one such thing, because we operate on the credit system. You know, you can't live here without understanding how credit works. So exchange rate risk is also important when you're doing intergovernmental business. Project risk. If you're a person who has projects to undertake, you have to look into how the projects are affected by COVID, right? Reputational risk. Some companies are folding because of the COVID situation. And if you're not in an industry which is STEM-based, that means you have all these risks and then some, really. So you have to totally understand how any one of these risks operate, right? Next slide, please. So what's at stake here? There are at least 7 different things that are at stake. You have to understand how customers and staff feel. So you have to know that everybody is very anxious and everybody is very sensitive because of COVID. And I think one of the panelists mentioned about even when somebody sneezes, you feel very, anxious about. Nobody says. I think it was Abena so who said it. No, nobody says "God bless you" anymore when you sneeze. So you have to understand how people feel. Use your intelligence quotient insights to adapt quickly to activities around you. You have to listen and respond even more so with the people who you deal with now. Listening takes a lot. There's a way to actually listen. I have a trick around that. You have 2 minutes for somebody to talk and you say very little. And then when they're done talking, you have to be able to respond. So, some folks may not know this, and it may have cultural innuendos or associations with it, but listening is important these days more than ever. You have to be able to motivate people around you who are quote unquote difficult, right? Some people make decisions based on religion, right? Some others make decisions based on being rational and practical. You have to know when to use either if you're that type of person, and you have to know how to respect others too, whilst you make decisions around that. You have to know that you can project a more dynamic image in spite of the challenges. You have to look the part if you want a business gig or you want an employment opportunity. You have to incorporate adaptive leadership in everything that you do, even in your family, within your family settings. And then at the end of the day, you have to get noticed. Now, getting noticed means that people have to see the actions of adaptive leadership without even mentioning it to you. You have to be able to show that you are living a different type of lifestyle because you've made it a point to know that things have changed and you have to change accordingly. Next slide, please. All right. So because we are in COVID times, and there is no cure for this pandemic, we have to lean on the side of prevention, right? Wearing masks, washing our hands quite often. There's actually there's a process of hand washing, right? You have to know how that works. You have to understand that risks, and I think the 10 that I mentioned and then some, the risk appetite must increase. You have to understand that because of the uncertainty, the nature of how things are very, very different, there will be that opportunity for risks to go up. And because it's going to go up, you have to embrace that, right? And be ready for that. You have to include people who are, include marginalized assets in your decision making. Don't assume that you know it all, right? People who you least bring to the table to make decisions, this may be a wonderful time to, you'll be surprised the people who you are not looking at, the type of wisdom they may have that can help you to get to the next level. Our situation now is more than money, right? Technical assistance is important. Volunteering is just as important, right? So if you know anybody who is willing to give their time and effort, embrace it. Take it as much as you can. Collaboration is just as critical, and embracing adaptive technology. So there are so many, now that you have been exposed to what adaptive leadership is, there are a slew of technology tools that can be made available for you to use to make better decisions for yourself. Next slide, please. So this is where questions are asked, but I'm sure that there will be a time for that in this session. Dr. Abe?
So much. Thank you so much, Dr. Adoo. Guys, like I said, he's a learned professor, so he has a way of presenting. Clearly, we could see that he touched on the most important areas for the topic, especially adaptive leadership. It is as a result of that the U.S. Nobody even thought that the U.S. was going to be affected with this corona pandemic like this, but because our leaders were unable to adapt to come to that realization that we are in a dispensation where leadership is needed in order for us to manage pandemic. And of course, he's a public health educator, so he understood the subject matter. Thank you so much, Professor Adoo. We'll come to the questions that are poured in after the next presentation. So at this time, I have also privileged to introduce the Director of Operations for Girls Excellence Movement. So this individual, Bucky, which I will introduce very well, a very interesting character. I've watched her from afar. I've followed her writing. She writes very well. She's an excellent writer. She writes for a newspaper as well. And she's very passionate when it comes to women and gender issues. There's some group of women called the Girls Excellence Movement, and they are so crazy when it comes to women and gender and girls affairs. They will go every length to ensure that a girl child is protected, and not only talk, but ensure that they are well protected in terms of legal representations, in terms of how do you call it, the counseling, just name it. And Bucky, I just want to let you know that we really appreciate the work you, Juliana, Mavis, and co have been doing. It's the right thing to do. It brings that social change. So Bucky Evans is recognized as one of the prominent voices advocating for women's rights and gender equality. She is an entrepreneur, an activist, and a writer for the Business and Financial Times paper. I'm sure Dr. Adoo will really like you. Once you write for a newspaper, he will like you because he's an editor as well. So she is the Director of Operations at Girls Excellence Movement, otherwise known as GEM, and the Corporate Relations Manager for Executive Projects and Protocol Ghana. She is the managing proprietress for Good Food Farm Limited, a startup founding partner of Gap Auto Services Limited, and alumni business advisory board member for Enactus, Ghana. She previously held positions at Priority Insurance Company Limited as the corporate relations manager at the headquarters, Vortex sectorial manager, and Aflao branch, respectively. Bucky Evans is passionate about volunteering and leading for a change. So folks from around the world, I am very happy to introduce our last speaker, Bucky Evans. And Bucky, just get to know that at this point, we have 618 individuals from around the world listening to you. This excludes Facebook and the radio channel. So if we put that together, we are close to almost 1,000 people listening to you. Over to you. Take us home on the topic, progressive social change and women empowerment in crisis. Thank you.
Thank you. Wow, that was such an elaborative introduction. Good day, everyone. It's such an honor to be part of this distinguished panel. Thank you so much, Jagils, for having me. I do believe it is my duty and by extension, our collective responsibility to talk about the very fundamental issues that propel human growth, development, and the advancement of women alike. That is why today I will be speaking on progressive. If you can project my first slide, I will be speaking on progressive social change and women empowerment, particularly in times of crisis. I would go straight to define what social change means. For me, there are transformations that have an impact on our society. And then over the years, we have seen progressive changes in the economy, the political front, even the religious caucus, the technological front, and across various sectors in the industry. And a woman's role has changed tremendously, I mean, and we are making greatest impact in our society today. Women continuously, effectively are change agents to these rather, I call them very resounding modifications. And that is what today I will be speaking on progressive social change and women empowerment, particularly in times of crisis, like I have in my next slide. Yes. So the next slide takes us to a social model, a social change model. If you can please go to the next slide, where that's supposed to be a model in which change travels through. So it starts with an individual, and then to a group, and then eventually to the society. That's how change travels. And what I'm trying to say here is that every day that we wake up, every day that you wake up, I wake up, our day starts with the word change. So from the beginning of the day, we start thinking of what we can possibly change. This could be changes in our lifestyle, it could be changes in our status, our habits, work, or maybe from a predicament to a better place. Now, these changes start occurring almost insignificantly with emphasis on ourselves. And as the days go by and metamorphoses into years and centuries and decades, the changes take a more refined, a more defined and collective approach, and consequently will affect a larger group of the society. Now, on the next slide, you'd see that there are 7 facets, which the leadership model calls the 7 C's to these changes. So changes actually travel through all these 7 steps. Like I already explained, it starts with the consciousness of self, then all the way to citizenship. Now, taking the COVID-19 pandemic, for instance, we would realize that the change has traveled through all these steps rather rapidly. And at this point, I'd like to say that some changes occur slowly, while others really occur really, really fast, like we're experiencing now. So it started with the consciousness of self. And then we saw the collaboration from different organizations, institutions, and government trying to find a common purpose or establish a common purpose and see how best they can manage the situation, or if possible, remove the situation from the system. And then there was a point where there was controversy with civility, where there were so many controversy theories, like that was being alleged that the COVID was biologically manufactured in a lab. There are still controversies around going on saying that it's a bacteria, it's not a virus, and controversies like that. But it got to a stage where now the citizenship has come to accept that we are in the new normal. Whether we like it or not, controversies or no controversies, there is a need for change. And then there is a need for change in the way we do things or the way we approach things. So once the change gets imbibed by the citizenry, it starts becoming a tradition, it starts becoming a norm, then it becomes the new normal, like we are saying with the COVID-19 pandemic. Now, I really want to touch on my next slide, the contributions of women in times of crisis. I'm an advocate for women's rights, and my conversation would really be tilted in that direction. The COVID-19 has actually shown the always essential role that women have always played, both in the pandemic and before the pandemic. And unfortunately, these roles are usually invisible, if not unconsidered or undervalued, or sometimes even ignored. So we realize that in all of this fretfulness, right, women have brought in vital skills to the forefront. Women bring in resources and experience and expertise. A typical example is the health sector in Ghana. In Ghana, we realized that in the health sector, the largest chunk of health personnel that you find are nurses. And out of these nurses, we have at least between 60 to 65% of these nurses being females. Women are at the front line. Mostly women are at the front line of this pandemic. And then not to talk about situations where there was shortage of supply for nose masks, and then there was shortage of hand sanitizers, locally made. So we realized that most women came on. Giving the credit to the women folk is the fact that we find a lot of women in the informal sector. And like I think it was Abena mentioned, there are women who are there are people who are into hairdressing. She mentioned hairdressing, she mentioned very informal skills. And we all can attest to the fact that there are mostly women in this kind of enterprises. Now, women have brought on these skills on board. They are manufacturing sanitizers, locally made sanitizers. They are manufacturing nose masks. They are manufacturing locally made soaps. What else do we need? What else do we need to fight the pandemic? These are the basic essentials that are needed. And then apart from that, we really had to stay healthy in order to be able to build our immune system and fight the pandemic. Go to a typical market in Makola or Agbogloshi or markets around the country. You'd realize that there are tens of thousands of women who are in the front making sure that our families are well fed. Now, it doesn't end there. Once this nurse comes home, once this doctor comes home, once the local manufacturer or the local innovator comes home, you realize that then they have the responsibility of now inculcating the guidelines, the protocols of the COVID into their children and the rest of the family. Because in the outbreak of the COVID, I definitely found myself doing everything coronavirus related, from staying on top of the news, learning about the new symptoms, having pep talk with my girls, explaining what this means to them without making them feel anxious, reminding them to go wash their hands every now and then noting if they have symptoms or not. And mind you, apart from that, I still have to couple all of that with my school work, my actual work, and every other activity that I had going on at the time. Kids have been home for the past days and weeks and months, and the answer to who takes care of them is heavily gendered. Christy Wallace said that women are typically the chief healthcare officers in the home, the chief entertainment officers in the home, the chief education officers in the home, and especially in a time like this where we do not have a particular path or a clear playbook, but we do have a lot of panic and anxiety and mental load. The weight of these roles can be quite overwhelming, not to be recognized in the first place. So, and the work doesn't even stop there, or the responsibility doesn't even stop there. Women are going to be in charge of rebuilding the communities in the aftermath of the crisis. What I mean by this is that women will take into consideration the psychological, the mental, and emotional well-being of everyone, starting from their families. That is why it is imperative that we ensure that women are empowered to lead the response. And that is why at GEM, we provide girls and women with leadership skills so that they are better equipped to lead their communities and to know their rights in times of crisis. Women hold the key attributes that are imbibed in her child, and then they grow to become adults, like I already pointed out. That by itself is an extremely potent area that, if we begin to recognize, will bring a really positive social change. So once we begin to recognize the roles of women and recognize that these roles are not isolated, that their lives have a meaning far beyond the confines of their home, that is when we begin to plant the seed of change. I would like to, at this point, talk about the challenges that affect, in my next slide, social change. So yeah, that affect women's participation. Many years ago, women's contribution to the society was limited and controlled by men, or I would say the patriarchy or the system. However, women are playing major roles and very important roles in many areas today. But irrespective of these feats, though, women are facing numerous challenges with breaking through fully into the world of change by several limitations. Number one on the list is inequality. Most women, I'm not talking about women in the big cities, they have quite a leverage. There are so many other women that are not in the cities and that are more in the rural areas. They lack opportunities. And I can even say same for some women in big cities, like probably Accra, New York, and the rest. And there are so many stereotypes against women. Most women lack access to technology, and even when there is when they have the access to technology, they lack the skills to actually access technology. And there's the issue of poverty. There are more women that are living below the poverty line as compared to the male counterparts. So it makes a lot of women more economically dependent on partners, on spouses, or even on children. And there are situations where you would find yourself in the same job description as a male counterpart, but then the truth there is you are likely to be less paid than your male counterpart, despite the fact that you are all playing an equal role within an organization. And women are mostly found in the informal sectors, so they do the jobs that are really that comes with less pay. And then there is the issue of sexual violence. Over this period of lockdown, surprisingly, there has been a really high surge in the cases of sexual violence and domestic violence against women, against girls, against children. And it's really causing a distraction on women's and and girls' ability to be equally productive members of the society. Just recently, the past few days, there were on the news a young girl who had been impregnated by her father twice, and there has been so many stories of this kind. A girl of 5 was raped and murdered. And the one that really broke the straw for me was a little girl who at age of 8 was, I don't know, for the lack of a better word, I'm sorry, but then she was raped through her anus. I'm sorry, I had to be really blunt. And then the medical officers had to say that her private part was damaged beyond control. I mean, these are real challenges that women and girls face. Women don't feel safe. Most women don't feel really okay. So if we still have these barriers against women, against children, I mean, how are we going to equally lead responses in times like these, or probably in worse times? And there's the high level of illiteracy. I say this because I have been on a lot of GEM outreach programs, and we see it firsthand, digital illiteracy especially. And we have come to the point where we are moving from the manual or the analog way of doing things into a more digital platform. I do not know how my grandmother, who is a market woman, or my mother would be able to transfer her wares or her business to the digital platform. Well, she is lucky. I may be able to teach her a thing or two, but she will not be, adequately empowered. That is why it's really important to start teaching young girls now, to start giving them an opportunity to also be productive in their lives, wherever they find themselves. Lastly, I would like to touch on one challenge. There are so many of them, but for the sake of time, traditionally, we do realize that women are so socialized into accepting lesser roles. It's been a systemic error. It's been in the system for far too long. We have been socialized to believe that that is the way to go. So women, we tend to socialize our children, especially our girls, in the same mode. Although we may have experienced the angst or the effect of being dominated. Unfortunately, the classical dictum is that by a girl or by a young woman or even by an aged woman, nothing must be done independently by you. even in your own house. In childhood, a female must be subject to her father. In the youth, she has to be subject to her husband. And when the Lord is dead, I mean, she has to be subject to her sons. So at what point can we say that a woman, or can a woman say that I am empowered? The role of empowerment of women has many, many facets or angles, from educational empowerment to economic empowerment to legal empowerment to ensure that her rights and her welfare are safeguarded. So despite all of these challenges, we still have a chance to correct the way things are done. Dr. Abi, please, if you would kindly move to the next slide. We still have the chance to correct the way things are done. I believe that we really need to involve men in the process of change, number one. I think Prof mentioned something like he believes in fairness and equality, but fairness and equality is the same thing. Basically, it's the same thing. To be fair is to be equal. So we really need people like Prof on board to speak on equality, to speak on fairness, like he put it, to speak on change for women. Because whether we like it or not, there are more men at the hierarchy in our institutions, in our organizations, in big governments. And then this change responses have to come from them, because now they have to start changing things. They have to now start enforcing regulations and policies that involves women and make sure that women participate equally in the decision-making table. There's also the need for us to advocate for women's rights by promoting gender equality, and most importantly, supporting feminist groups. GEM is a typical feminist. Feminist groups usually shouldn't come off in a negative light like we always see it. We are a group that empowers women, empowers women, empower girls to come out of their shells, to be better productive members of the society. That is what feminist groups seeks to achieve. And there is also the need of orienting our girls, including our daughters, even our sons. So once we start doing this, and GEM is really big on that factor, we go into communities, we go into schools, and then we encourage girls, we mentor them, we educate them, and inform them in order to transform them into great women of excellence. Also, there is the need to support women-owned enterprises to boost the productivity, because if half of the population is also bringing to the table what the other half of the population is bringing on, I mean, the males counterparts are bringing on, then you can imagine the kind of society we would have. There are so many ways that we can do things differently. We can design economic recovery packages for unpaid care work. We have a lot of women who are below the poverty line. We have a lot of women who are doing unpaid care work. The cleaners, you know, they are contributing effectively, even in this time of crisis. There are lots of cleaners out there, lots of female cleaners out there who really, really need to be considered. And we need to allocate, design and implement strategies that can actually attend to several gender issues. And in Ghana, for instance, we are expecting that the representation of women in parliament, that's the Affirmation Active Bill, will be 30% at least, but we are nowhere near the 30%. Women's representation in parliament in Ghana is nowhere 30%, and I just hope that we can really bridge this gap. So if you're listening to me today from any part of the world, can you please move to the next slide? I really would love to challenge you. Please, can I have the next slide? I really would love to challenge you to be an advocate for change. Give one woman one opportunity, because women earn less, they save less, they're likely to be employed in the informal sector, like I've said over and over again. It means that they have less social protection. So I'd like to call on leaders. This is a great platform to communicate the need for change. I'd like to call on our leaders, the individuals, government to explicitly recognize that and ensure that our COVID-19 response in this era intentionally, one, strongly, two, and permanently addresses these long-standing inequalities in order to create an all-inclusive and even more resilient society. Because chances are that your next CEO will be a she, your next parliamentarian will be a she, your next president even will be a she, or even like you guys say, your congressman, yeah, your next congressman will be a she. And the ever-revolving desires of development, right, drives the development of men and women alike. Okay, over the past 60 years, we have witnessed a conspicuous change in women's desires. Women wish to be less and less involved in household management, and we are increasingly expanding our involvement in other areas of the society. And at the same time, the world is pushing towards a greater equality. And women are assuming roles and responsibilities that were, I would say, traditionally filled or reserved by men. And technology is really helping us with all of these because it's playing a significant role. Just like today, we are able to use diapers, we're able to use washing machines, we're able to use blenders. Like we wouldn't have these kind of opportunities in the past. So by and large, the maternal qualities are expanding really rapidly from the personal home to the global home. We've passed the era where we keep singing, send your girl child to school, send your girl child to school. Now we are sending them to school. I mean, to a reasonable extent, we are sending them to school. What will be the use of sending them to school if we do not give them equal opportunities at the decision-making table? Just like Kwame Nkrumah said, the independence of Africa is meaningless until you know the code. So sending a girl child to school in code will be meaningless if we do not have an equal participation and have them bring their skills on board. So while these maternal qualities are really expanding to a global home, the female nature and drive to create a supportive and embracing environment would always be expressed because we will continuously create or try to call for a progressive level of change in our society. And then my final slide. So if you want to ensure that girls are included in learning, skills development, could be digital literacy, or just inspiring and motivating a girl child, or just eradicating period poverty and everything that concerns females, your sisters, your aunties, your mothers, who are rather living below the poverty line or who are getting violated day in and day out. If you really want them to be empowered with skills, during and after this crisis, I would implore you to mentor a girl today, the girl, or better still, you can support GEM to do that if you do not find the time or the resources to do that. Or you can do both simultaneously. You can mentor a girl today and then support GEM. Thank you.
Thank you so much, Bucky, for such a powerful presentation. I'm sure you know already, if they haven't told you, that I am a strong advocate for women. I have joined women rights movement all over the world, from Japan to Nepal to India, Pakistan, Sri Lanka, places where women rights have been suppressed. I've been there. And so the work that you and the rest of the Girls Excellence Movement is doing touches my heart a lot. And I thank you and Juliana and the rest of the team for doing such a powerful work. So thank you guys for powerful presentations. Tons of questions have come in. My goal is to close this by 12 o'clock. I don't want to keep you for all that long hours. And so we will go straight to some of the questions. But to start, let me ask those of you on the panel, those of you who got the opportunity to join the panel, if you have a question you want to ask directly, you can raise your hand. I'll call you, or just prompt me and I will let you know, and then you can ask your questions. Otherwise, there are a bunch of them, and I want to begin the first question that came in let's see. Well, Dr. Adoo, your hand is up, so maybe you want to start with you.
Well, thank you very much. I have had a really good time here. Before we start, I want to make sure that Bucky Evans, you are doing an awesome job. You and Juliana and your team, it is so needed. We need women in our lives and everything. I am part of an organization called Erratic Truth Foundation. We have a lot of different things that we do. So, you know, helping special initiatives in the community, you know, will be one of those things that you called me out, and I was actually going to sign up before you did. So I'm all in to help in any way, shape, or form. You know, like I mentioned, Erratic Truth Foundation is just as very critical in helping communities, so we can join hands to getting things done. Thank you.
Thank you so much, Dr. Adoo. All right, so let's go straight to some of the questions that came in. And so the first question I have here, it's actually coming from Pakistan, and it's coming from an individual called Malik.
Okay.
Oh, sorry, I didn't see. I'm so sorry. Dr. Andrew, you can go ahead. Dr. Andrew is also in Atlanta, so Dr. Adoo, you can hook up with him. You can go ahead, Dr. Andrew.
Thank you. First of all, Dr. Sami, I have to actually congratulate you for what you are doing, for selecting people like this of this nature. The four speakers, I was really inspired. Everything they said, in fact, that I felt very happy with what all of them said. That's the first thing I have to say. Now, I just want to say a few things. What Bucky Evans said concerning progressive social change, women's empowerment. I want just to ask a question. I know she said a lot. My question is this: which key policy areas can enable social change to empower women and alleviate gender dimension of poverty? All right, that's one. What I want. Then the other one I want to ask is on. This is just, yeah. I want to say here this: leading an academic institution is a time of crisis. It's stressful. It's very stressful. So what I want to ask here: what can academic leaders do to maintain productivity in time of crisis, such as this, when we have this COVID-19 that is troubling the entire world? So those are two questions I want to ask for those speakers who spoke on these aspects. Thank you very much.
Thank you very much, Doctor. So I will let Bucky go, and then since Dr. Adoo is academia and a faculty, I will let him also respond to your second question. So Bucky, you can take over. Oh, you're muted, Bucky.
I'm sorry about that. Can you hear me now?
Yeah, we can hear you.
Okay, so I'd like to talk about three key areas where we can tackle the issue of inequality or empowerment from. And these are educational empowerment policies that we can establish or is already going on, but then we need to amplify it. And then because in this aspect, we will be able to create awareness, okay, and then increase capabilities of how women participate in government. Because when you are academically informed, you are able to make very good decisions or bring very good reforms on the table. There is also the need for economic empowerment to decrease a woman's dependency and increase her participation as an economically productive member of her family and of the society. And I touched on legal empowerment a bit to ensure that her rights and her welfare are safeguarded, and also to encourage her, the woman in various forms, as an equal member of the society and to humankind as a whole. There's also the need for our governments to ensure that women are adequately participating in issues related to governance, in issues relating to the general welfare of the nations, because we cannot sideline 50% or even a little bit more than 50% of our population in decision making. And these are people, I mean women, who are responsible for bringing forth and nurturing even the boy child and the girl child, all of us, to grow into responsible adults. So there's the need to set up all these policies, or if they are being set up in other countries, like in my countries, there's the need to push for police enforcement to the maximum level as much as possible. Another way my brother can also help with this is to be part of the conversation, to lead change, to advocate for women's rights, to advocate for gender equality. There are so many resources out there on unwomen.org where you can get to learn about how to be an advocate or understand the challenges that women go through in these times. And then once you are very well informed, you'll be able to make or be part of the change. Thank you.
Thank you very much. Dr. Adoo.
All right, Dr. Iwani, I think I just want to make sure I understand your question. You're talking about which academic...
Yeah, I can repeat the question.
Okay, please, go right ahead.
Yeah, I was saying that leading an academic institution in a time of crisis is stressful, given that the role and the influence of the leader are magnified in times of change. So my question is this: what can academic leaders do to maintain productivity in a time of crisis such as this?
Okay, well, thank you very much for the question. Much of the time, people in the academic space, what we do is we work very hard to bring research to the workforce so that CEOs and other people in the workplace use the research we've done as a benchmark to decide what to do with the reality, right? In a lot of ways, many people always want to shun research. You know, they want to go with, give me practical, so to speak. But in order to really, for example, if you want to travel abroad, right? If you want to leave Lagos to New York, you can't walk, right? You have to be in an aeroplane. And the aeroplane will require a compass or a GPS to navigate the skies to get you to New York City, right? Same thing. That's where academicians come in. So for those of you, for some folks who are listening, and I think this is critical, you have to understand the important role of academia, right? People in the academics, people whose job it is to use theories and benchmarks as a, so that you can use as a tool to move forward. Now, our roles are very peculiar and also important at the same time. I want to focus in more of the new paradigm that I think can be useful in these times, called the adaptive leadership. So people who are managing organizations, folks like Bucky and Mayowa and Samuel and all the other folks who are on the panel, for example, I think it would be nice if you can look at how best do I adjust what we are doing now to mitigate the challenges of COVID, right? The list is long with what COVID is doing. I'm going to share some few points as to some areas that I think you can you can use as a tool to help your work or your business or your space. One of it is customer service. You know, this is not a paradigm that is fully blown in third world countries. It is very preeminent in North America and in Europe. But I think it is important that we totally embrace this. That means you have to treat somebody as much as you want to treat yourself. Within customer service, right, it is important to look at materials that focus on customer service management activities, the CX management activities. You can look it up. You have to totally understand the customer journey management. What do I mean? So when you're dealing with somebody, or you are in a community where everybody's afraid of COVID, right? Nobody's going to church, for example. Nobody is doing this, or nobody is doing that. It forces us to look at things a little bit differently now, right? So I have to find a way to live. I can't live by myself. I have to live within a community. Do I know the rules that goes with how to operate? You know, do I even know why I have to wear a mask, for example? You know, what mask is best? What layers of mask helps? So customer service in this particular context is, how best do I value myself enough to function in a community that is ravaged by this pandemic? You have to have a full understanding of yourself, right? You have to have an internal understanding of yourself. So you can read up material on what it means to have a customer service experience. You know, you have to understand how to capture feedback. Whatever that you read up.
Sorry, I have to interject because of the time. We want to make sure there are a bunch of questions here, so you can wrap it up, though, Doc.
Yeah, I am so sorry. You know, I was going there. You have to understand how the information you get, how best to use it. That's it. Thank you.
Thank you very much. So a question for you, Mayowa. There's a question that I was reading earlier on that came from Malik from Pakistan. And he says that under what kind of societal conditions do movement for social change emerge? Describe a societal context that has brought about or could bring about the development of such social change movement in respective to your presentation.
Can you please take the question again?
Sure. So the question is that under what kind of societal conditions do movements for social change emerge? Describe a societal context that has brought about or could bring about the development of such movement.
Okay. Let me give you an example. There was a situation in India where women had to form a coalition against logging in India. And today, that coalition has become a strong movement against logging to control climate change, the climate crisis that we are already having in the world. Now that's an environmental issue. A social condition like we have now, I'm going to give an example of what just happened recently in the United States and the air went around the world. That's the issue of racial injustice, where someone was killed, I'll say cold-blooded killing. He was not, to say, a criminal per se, and he just lost his life. And that raised so much dust that the whole world had to stand up for Blacks and people of other color. That's a social movement that was created by an agitated activity, something people had always have in their mind. wanting a change, but something had to come up to catalyze the reaction. And we've seen videos going around where whites had to apologize to blacks for the years and years of slavery and of racial injustice that had gone up, that had happened. So when something is wrong, when a situation is wrong, no matter how long it's been wrong, when people are strong enough to demand for change, that is when we will have the change that is required. Right now, we see all over the world, people of color are being given high-level positions like they have never been given before. In organizations in the United States, we see people stepping down, whites stepping down so that blacks can take up positions in the military, not because they were not qualified before now, but because in a way they were shut down. So agitations like this bring up social changes in our environment and even in the workplace when there is an agitation. But in the workplace, like Dr. Adoo said, we are designing adaptive workplace now, not the usual workplace. In an adaptive workplace, you need to understand the desires of the people as an adaptive leader, and which is what many people are now learning. On Twitter, on LinkedIn, someone made a post and said he does not understand what is going on about the racial issues, but he wants to learn. That's a person who has the character of an adaptive leader. So when there is an agitation, there's definitely going to be agitation followed by some legal actions. There's going to be a social change. I hope I answered that question well.
I think you did. Thank you so much for because of course the movement, you know, like probably in the last 10 years, nobody knew about Black Lives Matters. You know, this women empowerment group, and all of a sudden they've changed the world completely. We've also learned about the Me Too movement. Nobody thought about it, but once they were empowered and they realized it is possible, we've managed to bring some aspect of justice to the system. And so you hit the nail right on the head. Now, Dr. Adoo, there's a question here, and the person specifically mentioned your name, so I'm actually going to direct that to you. It said, how is the global expansion of social media likely to change how people pursue social change?
Very good question. Very good question. Now, when it comes to change, we have been so mentally designed to lock in that change is difficult, right? And I think I mentioned this earlier. Change is not, I mean, you know, change is an experience. We go through changes all the time. We go through different things all the time. But how we respond mentally to the change forces us to go by default. Oh, it's difficult because you're not accustomed to it, right? But you know, difficulty is just one of them. But change requires action, because whilst you are thinking about what to do about a new phenomenon, you are looking at different ways of interpreting and decoding the situation. So what I would say is this. Whilst we are looking at different scenarios in these troubling times, it is important for us to look at what is it for you, right? What is the result? What is the value of how you are thinking about things? You know, so if you're going to be able to understand how to operate within this environment, right, you have to look at social change from a perspective of results-based. You know, what is it that is going to change in a way that it will make an impact within your society? If you have that mindset, you can be able to process all things forthwith. I hope I answered it, because it's a very deep question, but I needed to make sure that for the sake of time, you understand it within that context.
That's absolutely true. Thank you so much for that perspective. Now, Abena, a question for you too here. you talked about societal disparities. What will be your recommendation in bridging the gap between these agenda disparities that you refer to?
Please come again with the question.
So the question is that you talked about gender disparity in the midst of COVID-19. What will be your recommendation in bridging the gap?
I was thinking of training for all. We should not distinguish sensitizing or training girls different from boys. If you are in your home and it needs to be painted, you can do it as a lady, not waiting for anybody to come and, do that for you. So with the gender bridge, it has come to stay. Like there are some jobs basically for men and others for ladies. So through this whole process, as we go about learning new skills, we just have to also come up with something that everybody can do, that there's not going to be a bridge like this is for girls or this is for guys. That's what I can say.
Thank you so much. And folks, I must mention that Abena, she's a nurse, so you could see she's already making a social change impact at the workplace. So she's with the marks and all that. Good question. Now, Bucky, there's a question for you here, Bucky. It says that, and this person said, I listened to you attentively, well presented, eloquently spoken, but the question is, it is often said that women are their own enemies. We've seen it many times. In 2018, the Secretary of State of the United States of America, Hillary Clinton, had an opportunity of almost becoming the president of the United States. But it turned out that statistics show that more women voted against him than men. And you also talked about the handful of women who are in parliament in your country. But it also may turn out the same way, that women will not support women to go higher. Where do you think we got it wrong? And how do we resolve that?
That question really took me. Well, very good question. I really do appreciate that this question is coming in now, because I beg your pardon, we do have a lot of these misconceptions. And so I think it's a really good opportunity to address the situation. Now, talking about women being their own enemies, I think it is rather a side that has been projected by the society. It's an angle that has been given to women in the society, because I could also, this is not gender wars, but I could comfortably say that men are their own enemies, because I see politicians rise up against each other, men, all the time. In our homes, we see men, fighting each other all the time. It's not a gender, it's not a gender issue. The term women are their own enemies, really. So I think, for me, it is a myth. It is something that would happen across board, between the male counterparts, between females. So that shouldn't be the basis for which we judge the competency of women. Now, given the fact that he's talking about Hillary Clinton not being voted for, well, there are several other issues, similar issues here in my country too. We should rather focus on competency, ability. What are you capable of? Does the majority see you as capable of handling this task? Yes or no? It shouldn't be a matter of generalizing that women are able to do this. Women are intellectually capable of handling a lot of issues. Every other issue as their male counterpart. For someone who gave you birth, who nurtured you, who trained you to be who you are today, you would be able to take on tasks if you are put in that position. And back to the issue of Hillary, it's a partisan thing. There are so many nitty-gritties that goes into why she didn't win the election. And now they have a male president, not because because of the popular notion that women are their own enemies or women voted against her. I would like us to take it away from that angle and discuss it even more intellectually. What were the reasons that she didn't progress, or probably what are the reasons that she didn't make it as the #1 candidate for the country? These are the issues we should be talking about, because on the grounds or wherever we find ourselves, there are conflicts between men and men, there are conflicts between men and women. So let us take that conversation from that stage and elevate it. Women are capable of handling situations, and they are equally capable of being in power and handling equally burdensome or equally huge tasks like their male counterparts. It is the intellectual capability and coupled with so many other factors, not petty fight.
Thank you very much. Because of our time, I promised to close at 12. We are 8 minutes past 12. But one more question for Dr. Adoo that came in, and then the rest of the questions I will send them to you by either on WhatsApp or email so we can respond, because we want to respect people's time. It's very important. And then we'll come for our closing remarks, and then we'll wrap up. Now, like in 30 seconds, a question is, if you happen to meet Donald Trump today, based on your adaptive leadership skills, what will you tell him?
Good question. Good question. When you want to offer change to somebody, you don't want to superimpose. You have to show why it works, right? You have to tell folks why it works. You can't. I may not even use him per se. I will use those he listens to the most. One of the traits which is important to him is trust. So in order to get to, at the end of the day, I want to make a difference, right? So the people who he trusts the most, I will ensure that they are around him. And I will ensure that I break it down to the barest minimum as to why adaptive leadership works, why it can possibly get him reelected, how it can embrace everybody else to get him the value that he deserves. So to answer your question directly, yes, I think it will be a fine opportunity, and I will insist that the people he trusts the most will be around him to listen in.
Thank you very much, Dr. Adoo. So at this point, like I said, all your questions and other questions that I have, I'll send them by email. We watch this 1 minute PSA of our institution, and then we come around to give our closing remarks. Just enjoy.
Hello, welcome to Jacobs Abbey Global Institute for Leadership Studies, a research, teaching, training, and leadership institute that critically provides strategic transformational thinking to leaders and students with the opportunity to develop and create lasting impact in their institutions. Championed by a world-class faculty, one-on-one executive coaching, and peer learning, our programs are offered both online and in cohort sessions. Jacobs Abbey Global Institute for Leadership Studies partners with academic institutions, civil society organizations, local communities looking to accelerate the impact of their leaders, more effectively engage teams, and build inclusive cultures of employee engagement and performance. We offer courses such as certificate, diploma, and advanced diploma in counseling psychology, marriage counseling, applied psychology, child mental health, conflict and peace studies, international human rights law, security and governance, and in gender studies. For enrollment, email enroll@jaglobalinstitute.org or visit us online at jaglobalinstitute.org.
Thank you very much. So now we go around for our closing remarks, and I want to start with you, Mayowa, in 30 seconds.
Okay, thank you. Thank you to everyone who joined us today. Thank you so much, Dr. Sam. And I will be leaving us with this word, like I said in my presentation, that COVID-19 has happened to everyone. And we all must understand that we need to be in the best mind frames to produce at maximum. And if we are able to do this, then we will overcome these challenges and we will all come out at the other side of it. Thank you very much.
Thank you so much. Thank you. God bless you. Thank you. Abena, I know you are at work, so let me get you off the way.
Oh, I'm okay.
Okay, very good. All right, so you can go ahead and give us your closing remarks.
I want to say that COVID-19 is real. And we need to take precaution. As I said, I'm in the health field now and we see it every day. So we should all stay safe. All the measures that WHO and the CDC are recommending, we should keep safe and stay put. This too shall pass. Thank you.
Thank you very much. Thank you very much. And Dr. Adoo.
Sure. Well, I'm so excited to be here. Thank you very much for the opportunity to share on your panel for this very important issue of how to adapt to the COVID situation. If you are a business person or an organization, if you're a government, if you're listening in, and you're trying to see how best you can use your resources to change things around for the better, I will insist that you bring me on board so that I can help change and make a difference. I can be found, you can go to my website at www.emcllc.expert. Everything I do is there. But for sure, I'm also leaning on the side of prevention, and I encourage everybody to follow the guidelines and use common sense to make best decisions for themselves and their community. Thank you.
Thank you very much. And Bucky, over to you. Take us home.
I don't want to sound spiritual, but I've gone through situations in life that birthed songs out of my.
Yeah, I would like to take this opportunity to touch on what Prof said. He said that social change is an experience, and really is. Over the years, we have seen, like on the women front, I always take it from that angle. It might sound a little bit biased, but I mean, so we've seen changes, progressive changes, conspicuous. We are pushing the front to make sure that we are equally represented. And then he also mentioned that we should see social change in a positive direction, and I really do agree with that. I'll take this opportunity. I'm a GEM ambassador, Girls Excellence Movement. I'll take this opportunity to talk about GEM, the fact that we are doing so much with our girls during the monthly inspirational outreach that we go for, and we are taking the opportunity to reach out to girls who need support and other forms of encouragement, and the list is actually really endless. So this goes to organizations, policy makers, stakeholders. Please, especially when it comes to the issues of rape, we need to find very rapid approaches, responses to these issues, because it looks like communities or organizations or the government or policy makers are really relaxed when it comes to these issues. And that's how come people are speaking up these days with the Me Too movement that Dr. Abi mentioned. You can find Girls Excellence Movement on all platforms, Facebook, Instagram, social, LinkedIn, even on Pinterest, and www.gemworld.org. Get in touch with us and let's change lives together. And BEM will be coming your way soon, Boys Excellence Movement, because we believe that the need to groom boys is really real. So we are going to be balancing GEM together with BEM. Thank you for the opportunity. I'm really grateful, and I've met very great people like Dr. Adoo, Dr. Mayowa, and Madam Abena. Thank you so much. I hope we're able to take this relationship further after this conversation.
Thank you so much. Thank you so much. Thank you for all of you for availing yourself and your time to make a real social change impact. Dr. Adoo always reminds me that the purpose of our networking is to complement each other's effort. So if you see a strength, please don't forget at all to reach out to me if you think that you want to partner with any of us. Like you rightly so, Mayowa, she is an external relation officer who handles the UK magazine, the African Leadership magazine. It's a huge magazine. If you know, you know. It's a very huge network based in the United Kingdom. Hey, let's partner and let's get the real social change impact, because once an impact is made, it affects the lives of other people. And so I want to take this opportunity once again to thank all the participants from around the world, a total of 817 in all, including the panel and the few who were also privileged to join the panelist view. I want to congratulate all of you for making an impact. God bless all of you. And at this point, I want to thank everyone again, and let's look forward for our August series. And as usual, I'm always available. If you need me to be on the show, on your panel, don't hesitate at all. But I challenge every one of you, don't just be a speaker, take action. Let your actions speak for itself. Let people know you for who you are, because you are an agent of change. God bless you. Enjoy the rest of the July 4th if you live in the US with your families. And if you live around the world, enjoy the rest of your time. God bless all of you. Have a beautiful, beautiful, beautiful evening wherever you are. Bye-bye.